So at a high level, the goals that we want to accomplish, obviously being in the medical industry, whether we're vendors or providers or management teams, is very challenging. And that is, we obviously, first and foremost, are all focused on creating the most impactful and positive patient outcome that you can create. And there's challenges in doing that today, due to financial challenges, due to digitization of the consumer experience, due to the just general Kardashian nature of patients and their demand for 24/7 access, their demand for immediate responses. So creating a positive patient experience is obviously everyone's goal, but it's challenging given the nature of the world that we live in today. And then you've got the challenge of being able to provide a return on investment or a strong patient outcome with balancing that with the practice needs. Practices need to run profitably. They need to be able to grow in many cases in order to maintain success, and provide improved capital investment into the business in order to generate further improved patient outcomes. So practices are dealing with rising expenses, they're dealing with turnover, they're dealing with digitization. So creating this balance of the most impactful return on investment for a patient with respect to their outcome, while at the same time doing that in a way that you can create a profitable and scalable medical practice is very, very difficult. And ultimately, the leverage points that are available, the most impactful leverage points that are available, are data and automation. You can't necessarily add more people in many cases due to expense, due to just a nonlinear process with respect to patient outcomes. Adding many more providers doesn't necessarily provide the solution either. But what does provide an understanding objectively, the analysis to be able to make the right business decisions, and the ability to create scale is data and automation. So today what we're looking at is, from a medical practice, you have inbound inquiries coming either from marketing efforts that you're doing or referring providers. Those efforts by the marketing department are then going to become commingled and tied to what happens at the front desk or a contact center. That contact center and front desk, based on scheduling and what's available to them, is now going to become dependent upon the provider and the provider's schedule and the provider's ability to administratively bring a patient in. Then these three groups, marketing, contact center, and provider, now would become dependent upon our RCM team. What is happening in insurance verification? What is happening with our third-party payers and our billables group, our payments collections group? And are we pulling all of that information together from the initial stages in an efficient manner so that we can collect the money that's due to the practice? And then ultimately, you need to maximize the value of that patient journey. That the maximization of the patient journey is going to create better outcomes, but it's also going to create a lifelong patient, and that generates the largest patient lifetime value. So really, in not just the medical industry, but in any customer acquisition focused business, you've got marketing, you've got scheduling or contact, you've got a service provider, you have billing and accounting, and then you got to focus on retention, or what we call in the medical industry, recall. And the interdependencies here are significant. They're challenging, but they can be maximized if you have the systems integrated to share the data and you leverage the data to make objective business decisions versus business decisions based on subjective opinion. Before we talk about what can happen and how to make it happen, now that we've defined the interdependencies, let's talk real quickly, and Noah was talking about this a few minutes ago, about the challenges that prevent optimization based on interdependent data and systems. This is the reality of not only most medical practices, but frankly, most businesses today. The medical industry is definitely behind. It's behind in digitization, as we all know. I think if you look across the United States, top 20 industries by size, as far as digitization of the customer experience, healthcare's at like 18 out of 20. It's actually behind construction. It's behind some of the traditional services businesses. So even though the value of what we provide and what we're focused on in regards to creating a healthier and safer world for patients, the digitization and the investment and the capital outlay that's occurred is nominal compared to most industries when you look at kind of the top 20 in the world, or excuse me, the top 20 in the country. But it's important to understand that all of these other business industries, whether it be finance, automotive, et cetera, they all started with the same challenge. And that is they had built a business off of fragmented systems and fragmented data. Obviously, practice management systems have done a good job of trying to take a big step towards consolidation, but they're long, long off from doing that. And they've also got a tremendous amount in front of them in regards to AI and ambient listening and creating efficiency in clinical administration. That true consolidation of everything you need for patient acquisition and scalability and integration of these metrics is going to not be found in the practice management world anytime soon, given the challenges that they face in moving their practices or their businesses along. But what you're looking at here is essentially you've got practice management data or patient data, right, living in the practice management system. You've got clinical records living in the EMR. You have referral faxes and pharmacy faxes and things like that coming in through a fax machine. Perhaps it goes to your email as an attachment, but in no way is it connecting to your practice management system. You have your voice over internet protocol, or essentially your phone system, occurring in a separate system. Perhaps it's RingCentral or Five9 or Vonage. All of that phone data, where phone calls are coming from, how long you're on the phone, whether the phone was answered, is all sitting separate from the practice management system. Your referring providers and the ultimate outcomes of their patients, though the patients are coming to you from fax, you don't realize that the fax is getting ultimately manually put into the practice management. You have a difficult time tracking it back to the referring provider, communicating with that referring provider because the information came over fax versus a digitized form. So it makes it difficult to enhance those relationships. If you have marketing efforts going on, you're going to have your website data in Google Ads. If you're buying paid ad media, that data is sitting not in Google Analytics, but in Google Ads. Your revenue cycle management could be occurring through a third-party system. Perhaps it's occurring through your PM. And then you've got merchant processing even. So even the collection or even the merchant processing, and whether your merchant processing is occurring in your PM system or not, that data can be separated. And really what you're looking at is the entire patient acquisition process includes aspects of all of this data. So unless you integrate it into one system and have one clean line of information from these disparate sources on the patient acquisition process. So if you take these 4 sets of data, okay, and leverage what are called APIs, you can ultimately bring it into what I would call an integrated data set, or in its kind of common technical term, a centralized data warehouse. And then what you need to do is you need to link it together by patient and by source. And so if you think about an Excel sheet on steroids, if you will, that's what you're really trying to do by bringing this data in, and you understand the source up here. You match it to the activity here, and you match it to the activity at a practice management level, and you can start to create a linear line of the activity of a patient. And once you do that, then you have analytics, and you have analytics that are based on revenue, that are based on outcome, whoops, and that can start to give you the interdependencies of the departments so that you don't make a bad decision with respect to optimization. Now, when you have integrated data and you have analytics, obviously practices cannot scale through human effort alone. They've got to leverage automation. Most practices today are leveraging typical traditional patient engagement automation around reminders, online scheduling, surveys, but there's additional optimization that can occur too at a significant level with respect to contact center technology. I know Noah's building out a big contact center right now for his team. I'll be looking forward to hearing about that here in the next couple of minutes and sharing the challenges that he's having with you there and making decisions. But you also have patient journey automation. We talked about the ability to have these patient journeys across all the different various procedures at a provider level, at a gender level, at an age level? How do you automate the communication of that in order to facilitate the most productive patient outcome and do it with practice scale and profitability in mind? So what you need to do is you need to integrate the sources of data. You need to centralize it into a data warehouse. You need to be able to pull out of it the key performance analytics that show you the interdependencies. And then you drive scale through automation and doing it in a continuous improvement process. And what I mean by that is analyze the data, automate your patient communication, acquisition, and retention, drive it through the process again, analyze the data again, continuous improvement. This is kind of a rinse and repeat process here in order to constantly be improving a practice. So at the top of the funnel, right, I need to know the risks and potential opportunities with where my leads are coming from. So I need to understand at a high level, where are my leads coming from? Are they coming from, or my inquiries, are they coming from referring providers? Are they coming from marketing channels, or are they coming from referrals? And what I want to be able to do is drive attendance optimization around that data. I want to be able to understand with respect to referring providers, do we have the right patient fit? So perhaps referring providers, one set of referring providers is sending a set of customers or patients that don't fit your protocols or your insurance policies. And that could be causing problems and ultimately end up with kind of an insurance or a collection issue. So understanding source of appointments at a billing and collection level is really important at starting and looking at things at the top of the funnel. Ultimately, what you're going to get here also, though, is when you can look at this patient history over a series of time, you can start to break it out by a provider protocol and understand the patient outcomes as well in a way that you can share those protocols with the other providers that are in the system. You want to be able to understand the front desk and contact center performance, so kind of carrying along this interdependency here. Marketing could be doing a great job. The inquiries could be strong, but you could have phone activity that's not productive based on missed call rates because you're not staffed productively. Or it could be that the quality of the inquiries aren't there. But without understanding what's happening at a user level, you're going to be left with opportunity cost in your decision making. But you've got to take that same data, and if you're going to look at missed call rates and answer rates by user, you want to be able to see that by campaign, right? Like what is happening at a website level versus a paid ad levels. Those rates are going to be different. Those contact rates are going to be different. Those schedule rates are going to be different. They may or may not be effective use of the team's time. For example, I'm sure many of the people on the phone today understand that, an organic website lead requires a lot less effort to deal with than Facebook leads or, meta ad leads. Now, meta ad leads can be profitable for kind of cash-based patient acquisition, but the reality is the volume against the quality is inversely related, which means the work required to make those media buys profitable is extensive on contact centers. And so you could literally be compromising the value of your referring providers and of your organic website by following up with paid ads, even though you see that paid ads are making you money, but you don't realize that the effort and the workload by the team members that are doing that is compromising your other channels. So really understanding at the front desk your answer rates, your call rates, not only at a user, but at a campaign and at a global level, being able to train your contact center team on what's happening through consistent communication, through templated communication protocols that they can use to drive a consistent patient experience. All of this is available in software today outside of the practice management system. Ultimately, AI will help make this process more efficient as well, and it will reduce some of the manual workload so that you can create more engaging consumer conversations without having to be typing or clicking or pulling. So we look forward to kind of future state opportunities there in this subject of contact centers. Patient experience, being able to look at the patient experience through surveys and online reviews is very important, but Typically what happens today is you just look at it at a provider level, or you look at it at a location level. You really want to understand it by the team. And what I mean by that is you really want to be able to look at patient experience based on the scheduling or the check-in process, the actual consultation or experience, and then ultimately the outcome. So you need to be able to group your surveys and your reviews in that level in order to properly manage the interdependencies of the practice. The practice is various teams that are associated with each step in that process. Future opportunities, clinical quality outcomes and clinical quality data is going to drive future value here with respect to this type of data. Being able to understand surveys and NPS scores and match them against patient outcomes, and then looking back at the patient journey by provider, you're going to be able to leverage clinical quality type data in your outcomes and create stronger predictive treatment protocols, which ultimately is going to create stronger patient outcomes. So the ability to integrate this data has huge opportunities with improving patient care based on matching this data of clinical quality all the way back through the process. Ultimately, if you leverage this type of process, you're going to create, if you create an understanding within your practice on the interdependencies of their responsibilities and their departments, you're going to create a higher level of engagement from your team members. That higher level of engagement and understanding is going to drive better treatment. So obviously you're increasing patient outcomes, and those patient outcomes with engagement are going to lead to profitability. But ultimately what we're talking about here too is you're also going to garner, if you're a data-driven business, the ability to drive preventative analytics based on clinical quality outcome metrics. And that's where you can really start to get scale in regards to both patient outcomes and practice ROI. So getting the systems integrated and the data integrated across the departments will create engagement. That's going to improve treatment. And the history of these two things is ultimately going to give you a stronger set of preventative analytics, which is going to create monumental scale in regards to outcome and practice ROI.